So much. I will be moderating this session too, and you will be hearing from me in a couple hours about GBS2. Well, I'm going to talk about something that I think is important to all of us. We know how to diagnose and know how to treat stroke perhaps better than we did ever, but there's still a significant problem with managing of the complications. When I was a resident, I thought that just avoiding swallowing of a patient who had a recent stroke would be all there is to get a patient to rehabilitation, as we could only prevent aspiration pneumonia. That would be important, and we could get them through. But there is a lot more to it. This study in 1998 already identified that there are many complications in patients who have an ischemic stroke. They noted that about 95% already had one complication, 50% mortality due to those medical complications, about 5% had swelling, and this is a patient with ischemic stroke where we'll be talking a bit about large hemispheric strokes. And that complication would have an odds ratio of 4, so it will be substantial. Already noted several decades ago that there is more to the picture here. So what I think the best way to approach it is that the medical complications can be divided due to either as a result of the brain injury or as a result of systemic injury, and it probably is, and now that's 20% would be due to brain injury and 80% would be probably due to systemic injury. So let's talk about the medical management of these severe stroke complications. It is treat swelling if swelling occurs. It's managing anticoagulation, treat hypertension, and avoid systemic complications. So both in ischemic and cerebellar hemorrhage, there is always some degree of edema. In large ischemic strokes, it's the mass effect that will do that, not through a mechanism of increased intracranial pressure, but more due to brain tissue shift from a rapidly growing mass. And in cerebral hemorrhage, it has now become far more known and of interest that there is periclot edema that can cause trouble and can cause a patient to deteriorate. So we're all talking about endovascular retrieval, and it's successful in a large proportion of patients, but if you then look at patients who do not, in which recanalization does not occur, you see that those numbers are still substantial. Of course,